Hello and welcome to the Skills Lab. Today I'm going to be demonstrating how to administer a medication via a nebulizer. This is a process by which a medication is added to inspired oxygen and turned into a mist. But first, let's consider a clinical decision-making process. I have just washed my hands and assessed my patient. I noticed during my gas exchange assessment that Mrs. Jones was complaining of shortness of breath and had expiratory wheezes, so I feel that she would benefit from a PRN bronchodilator. So I'm just going to come over to my MAR here and check and see what she has ordered. I can see she has a doctor's order for salbutamol, PRN. This is a drug that I've given in the past, so I'm familiar with its mechanism and its side effects, but I have a medication card for reference as needed. I'm just now going to gather my equipment and wash my hands once more. The following equipment is needed to perform this skill: a nebulizer mask, oxygen tubing, the medication of choice, and gloves to wear while preparing the medication. Now that I've gathered my equipment, I'm ready to start the process of medication administration with the first check of the 7 rights. This is a process that needs to be done with any medication administration. I'm going to start by checking my MAR. I'm looking to see that I have the right patient, I have the right drug, I have the right dose, the right route, the right time, the right reason, and the right documentation. After I've administered the medication, I'm going to sign it off on the MAR. Hi, Mrs. Jones, I'm here with your salbutamol. I'm now ready to pour my medication. For the sake of this video, I've completed the second check of the 7 rights off camera, and I'm ready to pour at the bedside. Everything was accurate. So I'm going to start with sanitizing my hands. I'm going to put on gloves because I'm going to be handling a medication and I don't want any to get on my skin. I'm going to take the nebulizer tubing as well as the cup here. I'm going to twist off the top. And I'm going to pour the medication in to the nebulizer cup. I'm going to screw on the cap. And that's it. Okay, so now I'm ready to administer the medication to Mrs. Jones. But before I do so, I need to make sure I complete my third and final check. This includes looking at her name band, having her verbalize her name if possible, checking her date of birth and MRN, and I'm going to check it to the MAR here. I'm also going to do my third check of the medication, that I'm giving the right drug, the right dose, the right route, it's at the right time for the right reason, and I'm going to document after I've put it on to Mrs. Jones. Now I'm going to come over to the bedside, and I'm going to hook this up to the oxygen. You'll notice that there's also medical air here, which you may see at some hospitals. However, if your patient is requiring supplemental oxygen, it is crucial that you always administer with oxygen. I'm going to turn this up to about 6 to 10 liters. And when I do so, you're going to notice a nice mist that's coming forward. I'm going to make sure that this medication is staying in the bottom here. And so I'm having Mrs. Jones sit up nice and tall. I'm going to have her take some nice, slow, deep breaths if possible. And this is going to last about 5 to 7 minutes. I have just completed the skill of administering a medication by nebulizer, and I'm ready to sign off on the MAR. However, there are still important clinical decisions to be made. I'm going to be looking at Mrs. Jones's rest rate and workup breathing. I can see that it's improved, her oxygen saturations are stable, and so I feel safe leaving the bedside and reassessing in 15 minutes. I'm going to make sure that she has her call bell within reach. If her condition had not improved, I would stay at the bedside and monitor for her. It's also important to note that with any medication, you're going to be monitoring for side effects of the particular medication you're giving. This concludes the skill of administering a medication by nebulizer. I hope you found this video helpful.